Good morning, my name is Brittany Ricky, and today I'm going to be doing the respiratory system dissection on the fetal pig. I'm going to first show you my area that I'm working in, and then we'll jump right in so that we can get through this pretty quickly. So here is the area that I've been working in, and this is my laptop with the experiment instructions and then the structures. So we will go ahead and lower this and jump right in. So first off, in the neck region, we have two different things that we're looking at. We have the larynx and the trachea. The larynx is this harder structure here, and the trachea is this bottom portion here, which is a tube that feeds all the way into the lungs. I cut the portion out on accident a few weeks back, but as you can see, this is the bottom portion and the upper portion. Moving on, we have the lung lobes. As you can see, these are the lungs. We have 6 of them total. Moving on from there, we have the thoracic duct. The thoracic duct is a little difficult to see in this view, but it lies along the dorsal surface of the descending aorta. So the aorta is up top here, and then the descending aorta, if I move this, is located over here. So it would be on the back side of that. Moving on, we have the helium. The helium is the point of entry for each of the lungs, for the bronchus, blood vessels, and nerves. So on each of those lungs, lobes, we would have that. Moving on, we have the viscera pleura, which is a thin, slippery membrane that covers the surface of the lungs. I removed a lot of this in previous weeks, but as you can see, this is an example of that thin layer. Moving on, we have the bronchus, which is the trachea, which we mentioned earlier. That branches into the left and the right bronchi. And then moving on, lastly, we have the diaphragm. The diaphragm is a thin layer of muscle that separates the thoracic cavity and the abdominal cavity, and that is located right here. And that is all I have for today.